The topic we're taking is complementary feeding. Complementary feeding. And this topic suggests that there is a main food. We're just adding or complementing that main food. We're adding something to that main food, or we're complementing something. So what would you consider as the main food for children below 2 years?
Breast milk.
Breast milk. So breast milk must continue until 2 years. We're complementing the breast milk with other feeds. So complementary feeding is the feed that is added to breast milk between 6 and 24 months. This period is a period of transition, and it's a critical period of growth. This period is the time where growth is fastest or highest. In other words, infants below 1 year tend to grow more rapidly than any other person, or growth at that stage is fastest than any other stage in life. The feeds at this time affect growth and development. If the complementary feeding is not appropriate, then the children will not grow well, will not develop well. That can affect the milestones. And like I've always said in this class, apart from the immediate observations or immediate effects of inappropriate feeding, if a child that is growing has growth faltering because of inadequate nutrition, the organ that is growing at that time is susceptible to diseases later in life. It's at a higher risk compared to um, other organs. So a wide variety of health foods are needed at the proper time, and delay beyond this age may lead to undernutrition. So if a child is 6 months and for whatever reason the mother is not giving extra food, some people celebrate breastfeeding so much that at 6 months they are not giving any other feed. The child is likely to tip into undernutrition. So at 6 months, the infants are physiologically and developmentally ready for new foods, and different tastes should be explored. Different kinds of foods and preferences should be explored. During this period, some children would outrightly show their interest in some flavors and non-interest in others. But it's important to introduce all kinds of flavors, and they will develop acceptance for some. What we recommend is that natural foods should be favored. We should give natural foods to these children during this stage, because during this stage they don't even they don't know anything like sweet taste. Breast milk is bland. So this is a great opportunity to introduce what you want them to take later. It's an opportunity to introduce natural food, natural flavors, so that they can grow up with such flavors and live healthy. So it means that if you want a healthy future for a child, that healthy eating habits must start from age 6 months. You need to make that child develop an interest or an acceptance of the right kind of flavor from that 6 months. If at 6 months you introduce packaged cereals, sweetened cereals, then that child is being, um, I don't know the word to use now. It's like the child is being programmed. That's it. Programmed for sweet tooth in the future. It's good to begin with a small amount of new solid foods, like a spoon. When the child clocks 6 months, you can introduce a spoon of mashed potatoes, a spoon of mashed rice, no salt, no sugar in anything, just tomato, no pepper. A spoon is fine, and thereafter the child may be able to take 2 spoons and you can increase it gradually. Like I said, it's good to avoid salt and sugar, honey, and other substances that have tastes that are not healthy. It's good to avoid them at this stage so that the child will not develop interest. It's also a good idea to find a quiet place for feeding to avoid distractions. Appropriate complementary feeding. What does it mean? It means that the complementary feeds should be timely, adequate, safe, properly fed, and in appropriate texture. Timeliness means introduce it at 6 months, not before, not after. Breastfeeding should continue for 24 months. Follow the child's cue to feed and stop. Give only one new single ingredient food at a time. Wait for 3 to 4 days before introducing another. Can anybody tell us why it's a good idea to introduce just one single ingredient food at a time? Anybody? Okay, nobody. The reason is that if you introduce just one single ingredient food and notice that there's an allergy reaction, you'll be able to trace it to that food. But if you introduce two at a time, you will not know the particular food that is causing the problem. Adequacy means the foods would supply adequate energy, protein, and micronutrients to meet the needs of the infant. For complementary feeds to be adequate, it must be parallel to that of breast milk in quality. We all know that breast milk is fluid. That's the simplest thing to observe. And that means that these complementary feeds should not be hard, should also be semi-solid. Breast milk is rich in protein, in essential fats, and other nutrients. So the kind of complementary feeds that should be given should also be rich in protein, in essential fats, and rich in iron. Iron is very, very important. To achieve this, a wide variety of nutritious foods from all food groups will be needed. There is no single food that can supply all nutrients. Therefore, we must explore different food groups. So a child cannot be limited to pap or rice alone and expected to grow well. Child must eat from all food groups, including the meat group. So the practice of sentencing a child to pap morning, afternoon, night, 7 days a week is not right. It's not good. It's just like giving it means that that child is fed with carbohydrates um, laden food, and there's no consciousness of giving enough protein or fat as well as micronutrients. So we must feed consciously, not erratically. Feeding must be intentional. The kind of foods that are combined, the nutrients that are in such foods must be well considered. Iron, like I said, is vital for neurocognitive development. So this means that if iron is not adequate, then the child's brain will not develop properly. Energy and nutrients are needed for growth and development. The amount of protein that is needed in one day is about 20 grams. That's for the infant. But please note that this is different for adults. Must be given in sufficient, all the nutrients must be given in sufficient quantities, not just enough that they are present. And the quantity of the semi-solids should be increased gradually as the child is growing. So to arrive at that 20 grams per day is to feed the child foods that are protein up to 1.2 to 1.5 grams per kg per day. Stable foods such as pap or rice, cassava, and others are fortified with protein-rich foods to be able to achieve adequate protein. So it's not compulsory to give a special kind of diet to the child or to buy special milk or special complementary feeds that are packaged in tins and cans. We can achieve this amount of protein needed by combining locally available foods that are rich in protein. Remember that I said breast milk must be ongoing during this complementary feeding stage. So 800 ml of breast milk will provide about 8 grams of protein. The rest, that's the remaining 12 grams, must be supplied by the complementary feeds. The protein that are given apart from the one in the breast milk should be identical to the one in the breast milk. Some animal proteins have amino acid composition very close to that of breast milk, such as milk, cow milk, goat milk, then meat and eggs. So this should be considered for the children. Safety is another dimension of this complementary feeding that is very important. So it's not enough to have all the nutrients available, but they must be given in a safe way. The foods should be hygienically stored and prepared and fed with clean hands and utensils so that infection will not be introduced. Foods are given consistent with the child's signals of appetite and satiety. That's what is meant by following the cues. So when the child gives a cue that he wants to eat, then is fed, and when he's satisfied, the mother or the caregiver should respect that cue and not force feed. So force feeding a child is not recommended, it's not desirable, it's not safe. Meal frequency and feeding method are also important. So we actively encourage the child to consume sufficient food using fingers, spoon, or self feeding. So no bottle feeding, and frequency should be based on the child's cues. Not child should not be timed by the caregiver. So the frequency should increase gradually. The World Health Organization recommends 2 to 3 times per day for children between 6 and 8 months, 3 to 4 times daily between 9 and 11 months, and for 12 to 24 months. Additional nutritious snacks are offered 1 to 2 times per day. The next thing we'll discuss is the texture of the feed. What is the complementary feed? What is it like? Is semi-solid? Is nutrient dense? So in other words, we're more concerned about the nutrient content of these feeds, not the quantity, not just the quantity that the child consumes. Is this the texture should be pury to lumpy to normal textures over the period. So initially to be more watery, and as the child is growing older, becomes more lumpy. So the texture must be suitable to the stage of development. Plates and spoons are recommended to be used, not bottles. That means even after 6 months, bottle feeding is still not encouraged because the teeth are susceptible to, I mean, to causing infection. The teeth may cause infection because it may not be properly washed and sterilized. Children who are healthy do not need any special complementary foods. Combination of different varieties of locally available foods will supply all the nutrients needed. Some nutrient-poor foods such as carbonated soft drinks and others should be avoided. They are nutrient-poor and not desirable. It's good to feed the children with whole grain products rather than processed foods to be conscious of risk of overweight and obesity right from this stage. Iron fortified type of cereal products should be used when cereals are considered. There are some situations where the caregiver may not have a choice but to give some cereals during the day. In such situations, the ones that are iron fortified are recommended. The following are inadequate complementary feeds: whole nuts and similar hard food, because the child does not have teeth to choose such, therefore they're not recommended. Unpasteurized milk can lead to infection. Unmodified cow's milk can cause gastrointestinal infection. Low fat and reduced fat milks and nutritionally incomplete milks are not desirable because they do not contain the essential fatty acids that are needed by these children. Honey, juice, carbonated soft drinks, tea, herbal teas are not desirable. The children are expected to grow and the herbal teas will not support growth. They are okay for adults if they are taken in moderate quantities, but not for children. Carbonated soft drinks are not desirable because not they are nutritionally poor and on, at the same time will increase the risk of overweight and obesity. So in situations where infant formula are used, they use cow's milk based infant formula fortified with iron. So there are some infants that need special formula and this must be done under medical supervision. For example, some infants who cannot tolerate cow's milk products or who are lactose intolerant, if they need to take special formula, they must be guided. The caregivers must be guided by medical experts. Because the water that is used for preparing the feeds are very important, we recommend boiled tap water, cooled, not taken in the hot state. And then the caregivers should be educated on how to prepare infant formula correctly. Some people make it too watery, in which case the density will not support proper growth. And then breast milk substitutes should be tailored to need for those who need breast milk substitutes. So we have said that substitutes are not expected. Breast milk should be given and complementary feeds should be added. But there are some children that need substitutes, maybe because the mother is dead or something. So at that stage of complementary feed, they should continue with their breast milk substitute while the complementary feeds are being introduced. So what are the factors associated with successful complementary feeding? What should we do to ensure that at that stage the children are properly fed and they grow well? On the part of the caregivers, there should be a wide variety of foods available in the house so that there can be a lot of combinations here and there that will deliver all the nutrients. They should also have good knowledge of food groups and the combinations. For example, even if there is little income, but the caregiver knows that combining rice and beans will give adequate protein, then she can go ahead to combine such with the little amount available and even may be able to buy small fishes. But somebody who doesn't have that knowledge may spend the same amount of money buying noodles without adding any form of protein rich foods, and that will not favor the child. So knowledge is very important. Apart from availability and knowledge, the feeding practices, the habits of caregivers also matters. Some people time the children, the time I will feed every 3 hours, but such practices are not desirable. Some also force feed their children. That's equally not desirable. So it's important to have good feeding practices. uh, the attitude of the caregivers matter. Must be patient and must practice responsive feeding. Just like somebody may be responsible but not responsive. So what the child needs is for the caregiver to be responsive. Whenever the child gives a cue, the caregiver must respond to the cue. Accessibility. Locally available foods can be given or should be given. And accessibility is should also be combined with other forms, other pillars of food security. Acceptability is another one. It means that we should limit access to the foods that the children or the child accepts. So some children may choose not to accept some kind of food. They should not be forced. If feeding is not done properly at this stage of complementary feeds, what happens? There can be micronutrient deficiencies in form of iron, iodine, vitamin A, zinc, and folate deficiencies. These are the common ones, but there are several others. Any nutrient you can think of, including selenium, molybdenum, and all the ones that are not common, can be deficient and can lead to all kinds of problems. So good quality nutrition is necessary for proper blood formation. So if it's not available, then the child can suffer um, anemia and other forms of problems. Vitamins, minerals, antioxidants are necessary for adequate red blood cells and white blood cells formation. Vitamin B6, vitamin B12, vitamin B9, and iron are very important. I've said it at least twice in this lecture, and that shows how important it is that the iron in breast milk is no longer enough, and therefore the complementary feeds given should be rich in iron. This iron gap is the widest in the nutrition gap and must be filled. If it's not if iron is not adequate, we all know that it will affect red blood cell formation. That means that the child is at risk of anemia. If there's inadequate nutrition, there would also be decrease in white blood cells. And we know that as doctors, we know that if white blood cell production is low, then there will be low immunity, and this can lead to diarrhea, respiratory tract infection, and other infections. So 50 to 70% of the burden of diarrhea diseases, measles, malaria, and lower respiratory tract infection can be attributable to undernutrition. So if that is the case, it means that most diseases that children present with in the hospitals are related to nutrition. So if we take care of nutrition of the child, then we've prevented several diseases. So talking more about the consequences, inadequate growth and development, child can be underweight, that's if the weight for age is less than expected, or wasted, if there is low weight for height, or stunted, there is low height for age. Stunting is a form of chronic undernutrition, whereas wasting is a form of acute undernutrition. But for underweight is either or both. So wasting can lead to if there's an acute problem, it can lead to underweight. And there's a chronic problem, it can also lead to underweight. But how you can distinguish between a recent problem causing growth spurting and the long-term one called stunting, you need to check the height, check the weight, and look at the age. So if the weight is low for height, that means the height had been attained earlier. The height is as expected, but the weight we are getting today does not fit the kind of weight we expect for this height. Then that child had attained the expected height earlier, is just having a recent problem that is affecting his weight. That is called wasting. But if the child has never attained the height that is expected for his age, that means he's been suffering from undernutrition for a long time. That is called stunting. This stunting is difficult to reverse after 2 years. So that means that there must be intervention early to be able to reverse stunting. Poor nutrition affects bone development. So for each height for age lost, height for age score that is lost, the person will lose 3 to 0.2 cm in adult life. So that means if a child is stunted, that stunting will affect that child forever. In adult life, it will still be shorter than expected. Protein energy undernutrition is another consequence, and it can be in form of marasmus, a thin body and stunted growth, or kwashiorkor, a situation where there is apathy, edema, large liver, and delayed development. Other consequences: poor cognition, that's poor brain development. Childhood is a period of rapid brain development. So the brain volume increases rapidly, such that 36% of the brain is fully developed by 2 to 4 weeks, 72% in 1 year, 80% by 3 years, and 90 to 92% of the adult size by age 9. So you can see from these figures that if there is no intervention before 2 years, then almost 80% of the brain is already the way it will be. And that child will grow up like that. That's why many people are stunted in their brain. They cannot reason fast, and there's nothing anybody can do about it. Because if they're already like that in adult life, there's nothing you can do. The person that is trying to correct the fool will just be beating himself. The brain volume achieved at the end of 1 year is an important indicator of later intelligence. Consequences continued. There can be increased mortality, as children who are undernourished are likely to suffer from mortality, and likely we have talked about infection, that's morbidity. So apart from the infection, which is morbidity, they are likely to die earlier compared to others. And then, of course, they are more susceptible to adults related diet-related diseases. But on the other hand, if you feed the child too much and there's too much calorie, it will lead to higher body mass index, and that would also be a precursor of non-communicable diseases later in life. High protein intake may lead to higher growth rates and increased risk of overweight and obesity in later life. So if a child is stunted at 2 years, it decreases the schooling years by 0.9 years. The reason is that when the child is starting school, people in the olden days, before they even called asked for the age, if a child's hand cannot reach the other side as expected, is too short for the class. They tell him to come back in 1 year. But even if in our days the child starts school and nobody tells him to go back home, he may not be able to compete with his counterparts very well and may be behind in school. So 16% increase in the risk of failing one grade in school as a result of stunting. There is also decreased lifetime income by nearly 10% in those people who are stunted. So overall, this undernutrition at this stage, or inadequate complementary feeding leading to undernutrition at this age can undermine investment in education because the children may not be able to perform well. The brain is not well developed to perform well. Now let's talk about the economic consequences. If there is inadequate complementary feeding, due to the negative effects of stunting on stature and cognitive development, there will be reduced adult income, significant economic impact, especially on the developing countries. So we know that Nigeria is an example of such countries, right? So there is so, so part of what is causing our economic problems is because many people were not properly fed at the stage of complementary feeding. There's higher risk of lower socioeconomic attainment throughout life by such people, and malnutrition accounts for 20% of reduction in productivity. That's why many people graduate and they keep searching for a job. They can't think of what they can even do to generate funds. The gross domestic product loss to malnutrition is between 2 and 3%. And this malnutrition cost the global economy 2.8 to $3.5 trillion, corresponding to 4 to 5% of global GDP annually. So you see from these figures how important complementary feeding is. And apart from the undernutrition effects, even the overnutrition is a big problem now. Obesity is increasing globally, especially in developing countries. The people in the Western world have known their problem and they are working on it, they are tackling it. But for us in this part of the world, many people have not even realized that obesity is a problem. And this has been shown that obesity actually affects productivity. For some people, it leads to early retirement linked with lower labor productivity. The societal consequences of malnutrition. Apart from all that we have discussed, this undernutrition especially is dangerous for girls. There's negative effect of undernutrition or intergenerationally because girls who are undernourished are likely to be stunted and that can affect childbirth. If a girl is stunted and gives birth to a baby, because there's low reserve in her own body, is likely to transfer. I mean, it's not. She's not likely to give birth to a big baby because the nutrients that are transferred to that baby will be less than expected, less than needed, and because of that undernutrition in the baby will be born with low birth weight, and the cycle continues. Like I told you in the last lecture, low birth weight would affect that child if there's no intervention. The weight will continuously be lower than that of of their counterpart. So this perpetuates cycles of poverty, cycles of undernutrition, and has negative effect on the entire society because there will be high morbidity. There will be a lot of infection and illness, disability, and mortality rates will also be high. Social cost of malnutrition is measured by disability adjusted life years. And this disability adjusted life years is the health gap between current health status and the ideal. Quality adjusted life years is years lived healthy. So what should we do? I need you to talk now, even if it means looking at the screen to say something. What is the way forward? How can we tackle the problem of inappropriate complementary feeds? I'll start calling you one by one now. So starting with Mary Cole, Taiwo.
Yes, ma'am.
Okay. Solutions.
As yes, plus health practitioners, we want to make sure to counsel women appropriately on complementary feeding, maybe address like general misconceptions that they might have. Because I've seen a case where they, I will not call it complementary feeding exactly, but they started feeding maybe from 3 months. So I think, and the excuse of that, oh, the mother, nobody really has time and all of that. So I think if we can address general misconceptions like that, support and encouragement also, that's one step forward, I think. Thank you.
So when mothers feed at age 3 months, the term is that they are introducing complementary feeds too early. So it's still complementary feeds, but it's too early. Next person, Adeola Adebowale. Adebowale is not on this Zoom call. So note in the attendance
I
that,
am now.
really? Okay.
Yes, ma'am.
Cole, I hope you have taken the attendance, 26 people.
Iyana should be attending, I spoke it earlier.
Pardon?
I said Iyana should be attendance earlier. Yes,
No. The
13.
one earlier is this 25 that I will take. All those people, they are no longer in this lecture. So take this one of 25 now.
But but there are some people that sometimes share devices.
Okay, that's another point. So that means, how do we know how many are you in class?
We are 31, ma.
31. Okay. So 7. Okay. Okay, so let's continue. What's the role of the healthcare provider, healthcare practitioner? Taiwo has talked about the health education, that we need to educate people. Many of them don't know. They don't know the right thing. That's why they are practicing wrong methods. So we have to educate families and communities, give them nutrition education, and them to improve their feeding practices, give them factual information, food demonstration, and then encourage family planning. So more points. Okay, so that's implementation of WH code for breast milk substitutes. The summary is that we need to encourage mothers to continue breastfeeding. Very important. After between 0 and 6 months must be exclusive breastfeeding, and between 6 and 24 months must be, the breastfeeding must continue. That's the code. That's the important thing. And they are not supposed to use breast milk substitutes except in situations where the mother has died or some similar situations. So can you give us more points for the role of healthcare practitioner? Okay, nobody is talking. I'll call. Adeola Adebowale, you said you are in
Um,
this class and we are waiting for
yes,
your point.
control of childhood diseases and maternal nutrition.
I didn't hear you. Control, what's the explanation? Anybody can read what you have said.
Well, childhood diseases can be better controlled, and maternal nutrition can be improved to generally improve healthcare.
How does that affect complementary feeding? So you don't know. Next person, Aramide. Aramide Aragbada.
Yes, ma. Good afternoon, ma.
Afternoon.
Control. The role of healthcare practitioner in controlling childhood disease and maternal nutrition. I think it also has to do with educating or implementing
How does
during,
that affect complementary feeding?
because if the mother is not adequately nourished during the pregnancy and even before conception, it can increase the risk of the child having common childhood disease like pneumonia, malaria, and that can lead to poor growth and eventual stunting in the child.
Very good. Next person. Next person, please. Okay, you are wondering, how do you know who is next? Is there on the Zoom the person that is after Aramide? Arinze Chukwu. Balogun Blessing, get ready. Very fast, please. Arinze, Balogun, Damian, Dolapo. Okay, very good. Dolapo and Isheoluwa are together. So in the attendance, I know that's 2 people.
So it's not equal. Okay, ma. Ma.
Yes, go ahead.
Okay. It helps with maternal nutritional status influences infant nutrition.
We are no longer talking about maternal nutrition institute. You can't pick the next point anyway. Who is ready?
Sorry, ma.
Ma,
Can I go ahead, ma?
Yes, go
This is
ahead.
Damian.
Yeah,
Okay,
Damien.
ma. Yes, ma. So, I wanted to the point on advocacy to government.
Very
So,
good.
I wanted to say, oh, okay, if you are collaborating, okay, with maybe with the government, and they can make advertisements on TV channels or like nutrition, how okay to wean off your child in terms of okay how to include complementary feeds, breastfeeding, all these things, just like advertisements, so that when mothers are watching maybe watching TV, right? So they can also still get the information even if they don't come to the hospital.
Thank you, Damien. So talking about the media, that would, I mean, what you have just said now, it's like the role of the media. But when you are talking about government, the ones that really concern the government will be advocacy for appropriate policies. For example, policies that support breastfeeding in the policies that support 6 months maternity leave will favor exclusive breastfeeding for 6 months, right? There can also be policies that would support maybe refrigerators. No, so that would be too little. Maybe policies that will support, yes, mothers who have resumed to close earlier. That would also still favor complementary feeding. So the mothers will have more time to prepare adequate complementary feeds and be able to continue breastfeeding. So those are the kind of things you should talk about under government. Exactly.
Yes, ma'am.
Oh, thank you. Are you still seeing my screen? It's like the screen is. Can you still
yes, ma.
see the slides?
Yes, ma.
Okay, good. For me, I
Um,
can't see. I don't know what I pressed. I can't see it.
I want to ask something that under this improved, ma, please, can you hear me?
Yes, go ahead.
Under these improved feeding practices,
Mm.
can we as health workers emphasize the importance of hygiene in food preparation and handling,
Yes, yes,
washing hands?
yes,
Yes, ma. To prevent communicable diseases, the risk for communicable diseases in the children.
yes. Very good. That's the kind of thing I expect to be reasoning out. Ah, the slides are. I don't know what happened. Okay, I can stop it and start again, right? So apart from health workers, government has many roles really. We're just saying that advocacy to government was important. Okay, so what Damian said, the media can be used as advocacy to government, and then what government will do will start with policy, and the policies can be on different things. Government can also be involved in implementation of interventions such as food diversification, food fortification, crop biofortification. For example, if you see cassava that is orange color, that has come out, it's not natural, that has come out of a policy or intervention that involve crop biofortification. The same thing with orange flakes sweet potato. You see sweet potato that is color orange, it's not natural. It's from crop biofortification to have more access to vitamin A. So government can also intervene in terms of food supplementation. And then of course the policies. Existing national policy on infant and young child feeding, like I talked about, flexible work schedule, lactation break entitlement, suitable environments for breastfeeding, policies that favor food crops rather than crash crops, and empowerment of low-income earners, especially women, increased allocation of resources, adoption of appropriate measures to implement the International Code of Marketing of Breast Milk Substitutes. So that international code I talked earlier on is supposed to limit marketing breast milk substitutes, encourage mothers to breastfeed, and give substitutes in rare cases such as mother's death, increase advocacy for complementary feeding, and incorporate actions into relevant programs. And of course, monitor and evaluation of the programs. So, next person, talk about the role of industry. That's Dolapo. Dolapo, I didn't forget you today. Dolapo Isheoluwa, who is speaking?
This is Dollar Forman.
Okay.
Now for the support from industry, protein and micronutrients deficient gaps. In producing certain food product or substances, they can integrate some other micronutrients into it.
Yeah. Isheoluwa. So the industry are also involved in education, like Nestle now. They give a lot of health education to healthcare providers. They can also produce new products that are not in existence. They can form it. What's the problem? Isheoluwa, are you speaking?
Yes, I was trying to talk, but the network was bad.
So can you talk now?
Okay, I'm talking about facilities for working women to sustain breastfeeding. For example, in working places, the environment should be conducive for women that are breastfeeding. For example, they should have rooms where women can go to express breast milk for their babies. And also, they should also have like breaks to be able to maybe see their children in the crèche.
Okay. They can provide facilities for working women. Thank you. Then there should be collaboration between all players. So improving complementary feeding requires a multidimensional approach. All the players, governments, communities, families, healthcare workers, industry, media, all of us are important. Policies and programs should be in place to improve it. Health, nutrition, agriculture, and social welfare sectors are involved. Private sector, industry. Research is also important. So we do more research to find out how to incorporate the nutrients that are most needed into the existing locally available foods. So we conclude that the first 2 years of a child's life are a critical window, and complementary feeding is a core dimension of care in this period. So appropriate complementary foods should be introduced at 6 months, and inappropriate complementary feeding should be avoided because of the several consequences. So the solution to these consequences lie more with the healthcare providers, the private sectors, the media, the government, the community, and effective collaboration is needed. Thank you. Over to the presenters now. So you have 20 minutes, right?
Ma, please, you have to enable us to be able to share the screen.
Who are the people? Mention your names now.
Okay. Father Esther, Aragbada, Aramide, Ikenye Joseph, and Quadri Abdulatif, Group 3 and Group C.
You can start now.
Ma, you have to stop sharing then so that we can also share. Okay. Ma, also it is showing that the host has disabled participant screen sharing. So you have to help us to disable participant screen sharing.
But you are a co-host. Why don't you try it first? You are a co-host now. Have you tried it?
It's saying that it's the host that has to disable participant screen sharing.
Honestly, I don't know. This is the University of Lagos Zoom, so I don't know. I'm not sure I know who allow participant. Okay, let me see. Allow host tools. Okay, try it now.
It's working now. I'll share the screen now.
Great, thank you. If you are presenting and you are not yet a co-host, put your name in the chat room, please.